Thanks very much for having us here. I've been very much involved with the whole process of finding shelters. We started back in March timeframe looking for what are called alternate care sites, and had actually going to partner with Bob Jones University to do something very similar to this. But we never had the need, and then the folks at Miracle Hill opened their doors at the rescue mission, and we used that a little bit. And then Lorraine and others, I don't know how you found this place, but this is incredible. So I just want to say thanks. The healthcare part in this, if you will, is we plan to have some nursing staff here, community paramedics available. I'm going to provide the medical oversight. If you think about it, our hospitals are quite full. I can only speak for Prisma Health Upstate for volumes, and we peaked a couple of days ago at 220 inpatients in the Upstate, just in Prisma Health, COVID positive. The highest we had was in the low 180s last July, when everybody thought things were getting really bad. So it's a huge concern to keep the hospital beds open, and this will allow us to keep the folks out of the hospital, again, by providing some medical oversight. And one of the things we're going to do here is provide oxygen, so we'll have nurses touching with these patients daily, and maybe here many hours a day, depending on the population. And we'll also be using telehealth approach, so that if something happens when there's not medical staff readily available here, we'll have telehealth available to these patients. You think about it, we can house up to 32 folks here, and they'll, potentially could get very sick, and they get sick rather quickly. So again, this is a wonderful facility and a great opportunity for us to care for the congregate folks, the sheltered folks, and we're pleased to be a piece of it. So that's this part, but now since I've got the microphone, I'm going to say something else. So let's all get our vaccines, okay? So let's talk about that for a second. I was lucky enough, I'm an emergency medicine physician. I was vaccinated yesterday, so oh yeah, thank you. I don't need to be clapped. Let me tell you that if you're worried about it, you can tell your folks that yesterday the emergency medicine folks at Greenville Memorial were fighting, wondering when their email was going to come, so that you could fill this thing out for the CDC so you could get in line. By the way, after you fill that out, there's another link to do another thing, which I didn't do, so I had to go back and do it again, but I got it done eventually. So that's, it is a little bit of a process. But one of the residents said to me yesterday, and this is how badly she wanted it. She said she would take it in her eye if she could get it today. And I'm like, whoa. So think about that. I wouldn't take it in my eye, sorry. But that's how much. And the text, because then people, as they were getting their scheduling, there weren't enough slots, and now they're being pushed out till December 30th and later, and they were very unhappy. So we're regrouping there so we can get more done quicker. So anyway, thanks for the microphone, and please get vaccinated when you have the opportunity. Thanks.